cost of treating the person. We have a rule in New York State and in the country, you don't turn a sick person away. But that means they undergo a lot of expenses for people who don't have adequate insurance or any insurance, and the DISH program has reimbursed hospitals like Littauer. But New York State would lose $6 billion over the next 10 years if these cuts were made. The capital region would lose 58 million of that. So I am here to tell the 1,000 people who work at Littauer, the doctors and nurses and aides and administrators, all the way down to the people who clean the floors at night and keep the place healthy, that we're going to fight and reverse this cut. The deadline is December 11th. That's when the federal budget runs out of money, and we have to vote for an extension of the budget. The DISH program, I've successfully beat it back before, but the need to do it is more urgent than ever because of the desperation that COVID creates. In 2018, the DISH program gave $3.7 billion to New York hospitals. Littauer, here they saved the numbers for last. It would cost this hospital $4.658 million. And New York would lose 75% of the DISH support if these cuts went into effect. Now, Littauer is such an important part of Fulton County. As I said, it employs 1,000 people, and they do a great job. Anyone here, who here works for Littauer? Raise your hands. Thank you. Thank you for the good work you do. It's known as a high-quality institution that has done a great job from when Nathan Littauer founded it. And he was one of the leaders in the tanning industry, right? Is that right? Yep. Yeah. And he was generous enough to fund this hospital. It is the primary care hospital for 31,000 residents in Fulton County. And because they're already experiencing a shortage of doctors, the DISH cut will prevent them from recruiting new doctors. We have a lot of doctors, 55, 60, 65, and with COVID, they're retiring at a more rapid rate. If they don't have the money and they can't bring in new doctors, wow, the quality of this institution and all the other institutions would decline significantly. In your press release, press people, you have all, I would like to read them all, but let me get my press release here. Here's the amount of money each of our hospitals in the region would suffer if we had this. As I said, Littauer is 4.6, Albany Medical Center 9 million, Ellis 8.5 million, Samaritan Hospital 11.6, Saratoga Hospital 4.8, St. Mary's not too far away in Montgomery County 2.6, St. Peter's 8.2, Columbia Memorial 3.3, Glens Falls 5.2. So these cuts would be devastating, and it would mean hundreds, maybe thousands of jobs lost here in the capital region because they wouldn't have the money to pay the people they need to provide the health care. So my pledge to the capital region and to every hospital in the capital region is I am going to do everything I can to prevent these awful cuts from going into effect. Awful enough in normal times, awful even worse in COVID times. And I've succeeded in beating these back before, but now more than ever we need to do it. And with a divided Congress, the good news is there is bipartisan support. There are some who want to cut. Yeah, let's let this guy go.
Sorry.
Yeah. A nice big truck.
Yeah.
So more than ever, we need to do this. As I said, there is bipartisan support, but there's a move by some in Congress to cut everything and spend no money. The very same people who don't want to fund COVID don't want to fund this program. So it will be a fight, but I think we can win it, and I will do everything I can to see that we win. So Sean, do you want to say something?
I would love to.
Yes, go wipe. And let me put my mask back on. We obey all the protocols. Sean is new here. When did you become the CEO?
45 days ago.
45 days ago. So this may be his first major, probably not.
Yeah, no, this is actually, you know, at this level, it is. So I appreciate the opportunity. So, Senator, thank you for taking the time to visit us. Given how busy you are in the activity in D.C., we're very honored to have you here today. I'm not sure if you remember, about 9 years ago, we met each other in Livingston County,
Right.
when I worked at a hospital there.
Yep.
It's evident now, as it was then, you're a champion for rural health care and for health care in New York State, so very much appreciated. As President and CEO of Nathan Littauer Hospital, I'm 45 days into this role, but Nathan Littauer Hospital, our staff, our medical staff, and hospitals across New York State have been in the fight against COVID-19 for about 250 days. So it has been a long fight, it has been a hard fight, and it has been very costly, economically and from a personal perspective. But let me tell you a little bit about this hospital. You know, we consider ourselves small, but we consider ourselves powerful. In my short time here, what we've determined is that power comes from three areas. One is the community that we serve and the patients that we're able to treat. Two is our employees, our medical staff. And the third is our relationship with state and federal constituents and folks like yourself that have helped us be successful going forward. Now, we're a rare breed in New York, as Nathan Littauer is a small but independent organization in upstate New York, but we're really playing a long game here. We need to be available for our community, not only as an access point for health care, but, Senator, as you mentioned, we're an economic engine for the region. We employ over 1,000 people.
Are you the largest non-governmental employer in the county?
I don't know if I can answer that. Cheryl, we are not? Okay. We're second.
Who's
okay.
first?
Which is next door. Yep. So, but we are grateful for you, Senator, because time and time again, you look out for rural community hospitals like Nathan Littauer.
I do.
The thing that COVID-19 has done is it's shown a bright light on the importance of local health care and local hospitals, of access to life-sustaining opportunities and care that's provided in our emergency departments and our special care units, and the continued access of primary care in our health centers. But more importantly, the pandemic has demonstrated the importance of our organization's workforce, from our housekeepers to our nurses to our providers, from the front lines where we're treating our patients and our residents, all the way up through the services and departments that support those individuals. All are critically important, and for us, they're our most significant asset. So, Mr. Senator, there are the tools that we need to make sure that we are healthy and in our communities. One is PPE. As you well know, PPE has been a huge challenge for organizations to be able to acquire it. It is our salvation and our shield. Securing PPE is a Herculean task, not just for us, but for every organization across the state and the country. And every healthcare worker should have the opportunity to have appropriate PPE to care for their staff. My staff can tell you stories of hours spent trying to find and secure PPE. And as a former physical therapist, I can tell you that our supply chain issues are a national sprained ankle, and it needs to be addressed immediately and needs to be strengthened. For Nathan Littauer to meet the Department of Health's 90-day mandate for PPE and the additional expense that we had to incur this year for our PPE source stock, it has been a cost of over $400,000 to us that was unintended. And that cost is unsustainable in the face of cuts that may be out in front of us. Senator, we applaud you for looking for ways to improve the supply chain. It's been very important to us and helping reduce that cost of PPE. 340B is another avenue for us. 340B is a drug financing assistance program designed to stretch scarce resources for hospitals, and it's under assault. The program is critically important to rural hospitals across the country and is one of our lifelines. If the proposed cuts go through for 340B, that's an additional $2 million of cuts in revenue for Nathan Littauer Hospital. And Senator, again,
they're fighting with the big drug companies.
Absolutely.
Pharma wants them to pay more.
Yep. And it would be devastating to us if it went away.
Side.
Yes. The Senator has been a huge supporter of ours for 340B. And the last is, as you have said, Senator, the disproportionate share or dish cuts that are out there for payments. We believe those cuts would be horrible for us at a $4.6 million cut for us. But I do need to acknowledge and thank you and your constituents in Washington for the CARES Act, for the dollars that come out. They have allowed us, in the face of the losses that we've experienced through COVID, to get to this point. And that is greatly appreciated. And I know you're championing additional relief efforts.
We are right now.
That are critically needed, not just here in New York State, but across the country. So, need to ask to advocate further on one more thing. The vaccines are on the horizon.
Right.
For vaccines for our community and for our patients, we are anxiously awaiting for them to arrive. But for us, from a logistics and a financial perspective, to effectively deploy the vaccines in this rural area, it's going to take funding and it's going to take resources.
That's it, right.
So, for us to be able to do that effectively, again, in the face of these cuts, would be incredibly challenging for us to get these vaccines out. So, I think we've all been on a surreal journey through 2020. We have had many highs and lows on this journey. But even in these dark times, there's a light at the end of the tunnel. We ask you, Senator, to continue to fight to support rural hospitals, to give us the tools and the funding that we need to continue this fight, and to allow us to be ready to face the next challenge that comes down the road. So, and I'd also ask you to please relay a message for President-elect Biden. I know you're going to be visiting him soon. Excellent. But tell him we offer our congratulations, that our hope that this is... Yeah. The hope that this is a smooth and uneventful transition, but not as bystanders. We're doing this as healthcare workers in the trenches, here every day, supporting our community and one another. My favorite leadership quote is from Colin Powell: "Perpetual optimism is a force multiplier." Your efforts and your results, Senator, allow us to be perpetually optimistic. So thank you very much.
Thank you, Sean. Well done. Okay. Yep. Okay. All right, we'll take questions on this subject, but one point I would make in addition to all the others: if you want people to move here to this county, and now it's becoming the exurbs of the capital region, and you want businesses to come and stay, one of the first things a person will ask, or a business will ask, if they decide they want to locate in Gloversville, in Johnstown, in Fulton County, do they have a good hospital? No one wants to move to a place where they're not going to get good health care if, God forbid, they have an emergency. And the fact that this county has been able to say we have one of the best rural hospitals around in the country is something that keeps people here, helps people move here. So that's very important as well. Questions on this subject first?
Is this debate, or is this you're advocating for this funding, does this need to also happen before a potential government
Yes,
shutdown?
it expires with the government shutdown on December 11th. So we don't have too much time. Yes, Mr. Levy.
Senator, what do you believe your biggest obstacle is to providing appropriate rural health care, and will anything change on January 20th?
Okay. On rural health care, actually, the two leaders in the country have been the two Charles E's in the Senate. Charles E. Schumer, Democrat of New York, and Charles E. Grassley, who is a Republican of Iowa. And we fight hard, and we've gotten some special funding for rural hospitals with Littauer. But overall health care and hospital funding, we've had some real opposition, frankly, from Leader McConnell and others, and I think it will get better on the 20th. Donald Trump has not been an advocate for our hospitals. Joe Biden will be, I think.
Is the other Charles in good health?
Yeah, he seems to be, yes, he did. I didn't want to bring it up, but he seems to be okay. Okay, any other questions? Yankee fan.
Yes, sir. On the subject of the...
By the way, we just today announced that the Red Wings are going to have a new owner in Rochester, but they'll be staying there.
Very good.
Okay.
On the subject of the COVID stimulus, what's the status of those talks at this point?
Well, there's a little bit of good news as of today. As you know, I had been eager to sit down with Leader McConnell, Speaker Pelosi, to have some discussions. And Leader McConnell for months has resisted that and just put a bill on the floor that had no money for hospitals, no money for state and local governments, etc. It was an emaciated bill filled with poison pills. But last night, They've agreed to sit down, and the staffs are going to sit down today or tomorrow to try to begin to see if we can get a real good COVID relief bill. So there's been a little bit of a breakthrough in that McConnell's folks are finally sitting down and talking to us.
Do you think one should come during the lame duck session of Congress, or do you think more money would be available under a president?
The sooner the better. People are suffering. Millions of people are out of work. People are dying. People are getting sick. Small businesses are going out of business. State and local governments will have to lay off thousands. The sooner the better. If we do one bill, I want it to be as big and robust as possible, but then we would probably go back and have to do another. When I negotiated the original CARES bill, which got the hospital here $9 million and our hospitals in New York hundreds of millions, we never thought COVID would last beyond the summer. That bill was done in March. Now we know it's here for a long term, so we're going to need several bills, is my judgment.
What's the priority? Unemployed people, small business?
There's a bunch of priorities. You can't choose among your children. Someone's sick, they need help. Someone works for a state or local government, they shouldn't be fired. Someone owns a small business, they should be helped. Schools should be able to open safely. There's so many issues, you can't just pick one.
Yeah.
Levy.
Senator, I think you just mentioned that you plan to meet with the President-elect Biden tomorrow, and I think you touched on it. The top three issues that you need to discuss with him.
Well, we have to discuss a big COVID bill with the kinds of things I mentioned: unemployment, small business, state and local government, and many health care, schools. But there's also funding the government, which will occur in the next while. And there's generally an agenda of what we're going to try to get done next year.
What do you think changed with McConnell coming to the bargaining table on
Well, I hope it's his members. Many of his members want to get something done. I think that might be it. But let's hope. Okay, thank you. One last question,
Well,
Lizzie.
if things go your way in Georgia, there could be a 50-50 split in the Senate. Who
Yes.
becomes majority leader if
Me.
it's 50-50?
Me. Because what happens is the vice president breaks the tie, and that vice president will be Kamala Harris, who is a Democrat.
It's my understanding that two senators who caucus with the Democrats are independents. That doesn't matter?
No, they vote with us. Okay, thank you, everybody.